Hello everybody, Dr. Educatiional, founder of Pronto Care. Today we're talking about a different important topic of heart disease called atrial fibrillation, which is the most common arrhythmia or heart rhythm problem disturbance that you encounter everywhere in the United States, around the world. There's more than 1 million cases a year that have been identified as atrial fibrillation. And unless you're in Boston, you say atrial fibrillation. So that's just a little different, but they both refer to the same phenomena where the upper part of the heart, the atrium, goes into erratic heartbeats, irregular and come fast. And with that, the rhythm could be going to, because it's irregularity, making the heart go into really not having enough chance to rest or to get the normal diastole, or the period where the heart get rest and gets oxygen and so on. So if this happened in an elderly person, that can lead them immediately decompensation into heart failure, and it can also lead to blood clots that could lead to increase the risk stroke by 8-fold. And the atrial fibrillation can be a real serious problem if it persists and continues to grow. We have to address that by two things: controlling the rate, number one, and number two, blood thinner if there's no bleeding problem or no contraindication. So these are two important things. And then we have to do a little investigation, find out why the person went to atrial fibrillation in the first place. Heart disease is the most common cause for atrial fibrillation. So we have to look for blockages, and we can screen patients with that, with a stress test or CT angio, or even cardiac catheterization sometimes to find out if the patient with risk factors and symptoms that have coronary artery disease that provoked the atrial fibrillation, or other causes like hypertension, high blood pressure is uncontrolled. We talk about some other main problems like alcohol intake and alcohol intoxication over weekends. That's a very common. We see it all over in the ER, in the emergency room, when people went out for a couple of drinks and then the heart went erratic, and then we found bingo, AFib or atrial fibrillation. And this was called holiday heart around the holidays when people had a little bit too much to drink. Same thing, alcohol is a toxin, and it leads to provoking the heart to go into this heart rhythm, atrial fibrillation. So other causes for that, thyroid problems, and any other intoxicants from drugs, whether cocaine, heroin, vaping, all these things can lead to provocation of atrial fibrillation. Number one, need to rate control if it's fast. Number two, need to do a blood thinner, especially if someone has concomitant hypertension, has diabetes, has elderly above the age of 60, a patient who had previous stroke, a patient who has heart failure, patient who, all these are a kind of criteria that really makes the risk of subsequent stroke from the blood clot that forms after atrial fibrillation takes place, makes it very likely, and I said 8 times the likelihood of stroke. So atrial fibrillation cannot be hushed or brushed off, and it needs to be addressed by your physician, cardiologist. We're here to serve, Pronto Care. And then the main causes is that you need to bring it to your doctor, and we'll be happy to take care of you in the order of events that was just described. Thank you so much.